Hi there. Today we're talking about carpal tunnel syndrome. Many of you have probably suffered from this. For those of you who haven't, it can be pretty miserable. Carpal tunnel is compression of the median nerve. That nerve runs right here, and there is a little fibrous band, or a tunnel, if you will, where the structures run through that power the fingers. Generally, the ones affected are thumb, index, and middle finger, but it can be the middle portion of the ring finger or the fourth finger too. Often, this top part of the hand can be affected, can be a source of great discomfort, especially at night for those who suffer from it. So, we'll talk about risk factors, what to do, how to figure out if that's what's going on. Risk factors for carpal tunnel include being a female, a BMI of greater than 25, which is technically considered as overweight, people who have low thyroid, diabetes, arthritis, pregnant women, and people who do repetitive movements, whether that is on their tablet or their phone, typing, or some sort of fine motor work with their hands for their profession. So we talked about these fingers being affected, but what symptoms do people have? Usually it will start with a numbness or a pain in that distribution. It can be tingling and even weakness. Oftentimes people will have wasting of what we call the thenar eminence, and that is actually an indication that there's been some nerve damage and that person needs intervention more quickly. If you're just having the discomfort or a little bit of numbness, we don't have to be quite as aggressive. The symptoms are usually brought on by anything that compresses this area where you may keep your wrist flexed. So we often see it while people are at work, typing, or doing other fine movements, but also when people are asleep. This can be a significant contributor to sleep problems, because when people sleep, they tend to flex up in a fetal position.
Carpal tunnel! It's Oh Jesus, he's got it bad! Quick, we need Bengay!
One thing that people will often tell us is that it improves with position changes, certainly things where you straighten out your hands, or shaking your hands can help the symptoms to clear up too. For diagnostic purposes, often I don't need much more than someone telling me the story to know what's going on. If we're going to try to elicit this with different maneuvers that we may perform in an office setting, what we typically do, we'll have people reproduce activities that tend to bring the symptoms on. One thing that your doctor might do is either compress or use a percussion hammer to tap on the carpal tunnel area to see if that reproduces your symptoms. They may ask you to push your wrists together or potentially hold your hands over your head for 60 seconds or longer. These can be very helpful diagnostic tools. Occasionally, we will have to send people for EMG or electromyogram. Translation, nerve conduction studies. If we're not sure that that's the problem, we also have to worry about problems up the arm, whether that's in the elbow or the shoulder, potentially even coming from the neck or the spinal cord. But if we're pretty certain that the problem is coming from right here in the wrist, often we won't need to order those further tests. Again, if someone has that sign of wasting of this muscle, that's an indication that they are a bit more progressed and we would want to get a quick referral off to a surgeon. How do we treat carpal tunnel? Many cases do not require surgery, thankfully. We also used to think that everybody needed to wear their splints 24/7. It's turning out that that's probably not the case, and more recent studies show that nighttime splinting alone is as effective in some people as 24-hour splinting. Sometimes we'll employ steroid injections in the area to help decrease the swelling. That can be used alone or in conjunction with splinting and hopefully at least buy people time so it can heal, or just prolong time necessary to surgery. If someone has one of the underlying diseases that I mentioned before, like hypothyroidism or diabetes, obviously we want to treat the underlying problem as well as the carpal tunnel. I actually have one patient who hates taking his thyroid medicine, But when he takes his thyroid medicine, his carpal tunnel symptoms completely go away. So he and I have gone round and round about this for years. You know who you are. If your carpal tunnel is caused during pregnancy, usually resolution of the pregnancy, translation, having the baby, fixes it. I had it pretty bad when I was pregnant with my twins, and then about 6 weeks after my C-section, problem solved. Surgery is the definitive treatment for carpal tunnel, and we just don't want to wait so long that people have permanent nerve or muscle damage. So don't ignore this, like I said earlier, and if you have that muscle wasting, please talk to your doctor about getting referral. The good thing about carpal tunnel surgery is that it is not super invasive, it's not a super involved, long surgery, and there's not just a ton of recovery afterwards. Usually people are back to their activities very quickly. Very interestingly, there are some studies that show that actually carpal tunnel can resolve spontaneously within 2 years. So if you are splinting and you're tolerating things okay during the day, if it doesn't seem to be getting worse, then you might not need any more intensive therapy than that. But if you start to show signs of nerve damage or muscle wasting, please don't ignore. Don't forget to like and subscribe. Stay tuned for more.